Hello, welcome. Today we are going to see the spinal cord. So here I am having the brain with the spinal cord. You can see spinal cord is the continuation of medulla oblongata. So medulla oblongata is a part of the brainstem. You are seeing the medulla oblongata and the pons and midbrain is inside. And the medulla oblongata continues as the spinal cord. And spinal cord is the continuation of the medulla oblongata and it is present in the vertebral canal. It is about 45 centimeter in males, 42 centimeter in females, and weighs about 30 gram. The spinal cord extends from the first cervical vertebra to the first lumbar vertebra. Now let us see the details of the spinal cord. Just like the brain, the spinal cord is also covered by the meninges. The meninges which covers the spinal cord is known as the spinal meninges, which have the same three layers. We have the dura mater, arachnoid mater, and innermost hyoid mater. So here you are seeing this is the spinal meninges, okay, and this is the dura and arachnoid mater. Hyoid mater is closely adherent to the surface of the spinal cord. Now, if we closely examine the spinal cord, you can see that it is a cylindrical structure and it is compressed anteroposteriorly, and it has got two enlargements. One is at the cervical region called cervical enlargement, another is the lumbar enlargement. Here is the cervical enlargement you can see, and if you see towards the lumbar region, there is lumbar enlargement. Now the terminal part of the spinal cord or the lower end of the spinal cord terminates in a conical manner is known as the conus medullaris. Let us see the conus medullaris. Here is the terminal part of the spinal cord. This conical part is known as the conus medullaris. Conus medullaris. Okay, and remember the conus medullaris lies at the level of L1, first lumbar vertebra. From the conus medullaris, you can see there is a thread-like structure. This thread-like structure is known as the phylum terminal. Phylum terminal, and the phylum terminal is the modification of hyoid mater, and it's a non-nervous structure. I told you the spinal cord is present in the vertebral canal, and the outermost covering of the spinal cord is the dura mater. Between the vertebral canal and the dura mater, there is a space that is known as the epidural space, and between the dura mater and arachnoid mater, the space is known as the subdural space, and below the arachnoid mater or between the arachnoid mater and the hyoid mater, we have the subarachnoid space, and the subarachnoid space is filled with cerebrospinal fluid. It's a cylindrical structure which is compressed anteroposteriorly. It has got a ventral surface, and posteriorly we have a dorsal surface. At the ventral part, there is a fissure. This fissure is known as the anterior median fissure. So here we are seeing the anterior median fissure, and inside the anterior median fissure you can see the anterior spinal artery. The same way posteriorly we have the posterior median sulcus. On either side of the anterior median fissure we have anterolateral sulcus. The same way posteriorly on either side of the posterior median sulcus we have the posterolateral sulcus. There are 31 pairs of spinal nerves. I'll show you some of these spinal nerves. So here you can see these all are the spinal nerves. One spinal nerve here. These all spinal nerves are, we can see, and the spinal nerves arises from the spinal cord by rootlets. You can see there is a special structure, a conical shaped structure. So this structure is known as the ligamentum denticulata. So ligamentum denticulata are the modifications of hyoid mater. So there are 21 pairs of ligamenta denticulata, and this ligamentum denticulata runs laterally, pierces the arachnoid mater, and anchors into the dura mater. At the lower part of the spinal cord, you can see these all are the spinal nerves. Okay, so the spinal nerves makes a special arrangement. Okay, so this special arrangement is known as the coda equina. It appears just like that of the tail of the horse. So that is why this arrangement is known as the coda equina. So that was some of the basic information regarding the spinal cord.